And when it comes to golf injuries, low back pain injuries take up 54% of the injuries. So that one's the one that we see most often. And why do they happen? Most of the reason is overuse. You're doing the same motion over and over and over again. It's often not from just one bad swing. It's just the repetition of the same wear and tear on the same muscles and ligaments. It could also be a problem with your form. So if you want to get really specific with your form, you could look at working with a swing coach. Sometimes when we're talking about that medial inside elbow pain, that can happen from just simply gripping your club too tight. Failure to warm up. So when people do stretch and warm up a little bit before a round of golf, they're actually 50% less likely to get injured. So we'll talk more about how important it is to warm up before you play a round of golf. And then altered biomechanics. That's kind of where, as a PT, that's where I come in a lot. So if we talk about your glute muscles, the muscles of your bum are really important in the golf swing. And a lot of times people have very weak glutes because we sit a lot, and then our hamstrings take over, and then we end up with low back pain. So when I was telling my husband about this presentation and what I was going to talk about, he said I had to include this clip. So I'm just going to play this quick for you.
Same pain or different pain? What's that? Same pain or different pain?
Well, it's just my glutes are shutting off, and then they don't activate, and then hence, it goes in my lower back. So I tried to activate my glutes as best I could in between, but they never stayed activated.
So this was from that was from a golf tournament, and you all know the long history Tiger Woods has had with back pain. So he's talking about how his glute muscles weren't firing, and then when they're not firing properly, some of that movement from the hip will actually come from your back, which can contribute to the back pain. So if you look at this picture, you can see how many different muscles are involved with every different aspect of your golf swing. So that's, there's over, 650 muscles in the body, and we use a lot of them when we're golfing. So what ones should you focus on? The most important ones when we're talking about strengthening are those glute muscles that I talked about. So those muscles of your bum, and we're going to talk about some strengthening for these at the end. Your pec muscles, so the ones in the front of your chest, these huge latissimus dorsi muscles in the back, the muscles of your forearm, and your core muscles. Those are kind of the biggest ones you should focus on when you're doing strengthening exercises to make your golf game better. So we're going to talk more now about the most common injury, the back pain. So again, if it can happen to the best of them, it can happen to any of us. And maybe some of you have already had some back issues on the golf course. So some of the biggest reasons why back injuries occur in golf is core weakness is one of the biggest ones. So when we talk about our stomach muscles and our back muscles, when we have weakness there, that's can be really troublesome in golf. The poor activation of those glute muscles, like I talked about. Decreased back flexibility. So if you're not stretching out your back and you're really tight, you're more prone to get injured. And decreased hamstring length. And again, those hamstrings are the muscles in the back of the thigh. They kind of go from the bum to behind the knee. And we will show you ways to stretch those at the end. So what can you do, right? So if we talk about strengthening your core, when I first ask people how they strengthen their core, a lot of people will tell me they do sit-ups and they think, I do 30 sit-ups a day, so my core is great. When you're doing sit-ups, you're actually working kind of this big, long rectus abdominis muscle, which really does nothing to stabilize your back. It just gives you a nice six-pack and could look nice, but it doesn't help with stability. What you want to focus on is this really deeper part of the core muscle right here. It's called your transverse abdominis muscle. When you have people with chronic back pain, 80% of them have been shown to have weakness in this transverse abdominis muscle. And this will be on your handout as well. But the way you can activate it, and you can try it now, it's something that people really figure out at first with no problem, or it takes a long time to learn how to do it because people don't really know it's there. They don't know what it does. The muscle itself actually starts in tissue in the back and then wraps all the way around the front of your core and then inserts on the other side. So it's almost imagine it's like a work belt that we already have in our body. So if you take your hands and just kind of place them, come up a little bit. If you place them kind of at the small of your belly, and then from here, all you're going to do is just gently try to pull your belly button back towards your spine. that's how you activate that transverse abdominis muscle. It's a gentle contraction, so you're not pulling in really hard. And the most important thing is that you don't hold your breath. So if you try to pull that muscle in and you try to hold it, but you're holding your breath, you're actually using the wrong muscles. So again, this is one that's going to be on that handout, but teaching, kind of learning how to contract that muscle is super important for people that are having problems with their back or to prevent back injuries in the future. So when we talk about the core is actually, technically now we call it the lumbopelvic core. So it's your back, it's your pelvis, it's the, your abs. So it's the whole area. And when we look at the back, if we look here, we talked about the glutes a bit. The way you can start to isolate your glute muscles, because as I mentioned, a lot of times they just don't function like they're supposed to, is if you're just even sitting right now, you can try it. You're just going to very simply kind of squeeze your bum together. You should feel that when you tighten that, you're going to lift up off your seat a little bit. That's how you start to isolate your glutes without using your hamstring. And then the other important muscle for the back is this small muscle here. It's called your multifidus muscle, and it's on both sides of the spine. It runs all the way up the spine on either side. It's a very small muscle, but it's a really huge stabilizer for the back. And when we have weakness in that multifidus muscle, they see an increase of development of lumbar spinal stenosis, which is arthritis in the spine. So if your doctor has ever told you you have spondylolisthesis, stenosis, a herniated disc, something like that, it's really important to have some strength in that multifidus muscle. So the second most common injury is the shoulder joint, and you'll probably hear people say that, they have shoulder rotator cuff tendonitis or impingement. If we look at the shoulder joint, it's very complex. Our shoulder moves, it doesn't just go forward, back, out to the side. It rotates, it spins, so it's very complex. This just shows you the main muscles of the rotator cuff, but there's also a ton of ligaments, and it's a joint that really is pretty unstable. Actually, if you can envision, if you took the shoulder joint and kind of turned it on its side, it's almost like a golf ball sitting on a tee, right? So it really doesn't have a lot of stability. It needs a lot of strength in the shoulder muscles to keep it in place where it needs to be. Now, so some causes of shoulder pain, we go back to those swing mechanics. Maybe you're just hitting down too hard on the ball, but a lot of it can come from poor posture. So if you kind of, take a look at yourself in the mirror, I'd say most people that I see for golf injuries look a bit like this guy on the right? So a lot of us we spend a lot of time slouched over our computers or our cell phones, and we've started to get very tight in the front of our chest. And what happens then is we get very weak in the muscles in the back of our shoulder blades, so that it kind of is a vicious cycle. We get a little tighter in the front, weaker in the back, and over time you might notice that it's harder to stand up straight. So what happens in the shoulder joint, our shoulder joint is meant to be here in this position. A lot of times people are here, and then that just narrows the canals of where our muscles should be. And then when you're going to swing with the shoulder in that position, it actually pinches down on the tendons of the shoulder and can cause that discomfort. So a lot of it comes from posture and strengthening and keeping yourself nice and stretched out in the front and flexible. So like I said, really important to pay attention to the posture. So even just correcting your sitting and standing posture. I tell people to think of, when it comes to posture, if you think of your back as a letter, your back, a lot of times I see people in their back looks like the letter C, right? So that's just a big curve. You want to imagine it more as a gentle S curve. So it's going to come out a little bit at the top, in a little bit at the bottom. And alignment wise, you want to always try to keep your ears, your shoulders, and your hips in a straight line, okay? So if you are at a desk a lot at work, if you're on the phone a lot, you want to think about that positioning. So having a good setup, especially now with people working from home, really making sure you're in good alignment when you're sitting at your workspace. And when you're on your phone, the second you start slouching over your phone, it's poor positioning for your neck, and then the shoulders rotate forward as well. So we really want to make sure that we keep ourselves in that nice upright positioning. If you're on your phone, just holding it up into this position instead of slouching over top of it. And we know phones and computers aren't going anywhere. So if we can kind of learn the right way to position ourselves, we'll only help ourselves in the long run. So another thing when it comes to positioning is that when you're setting, so when you're addressing the ball, right, you really want to think about your posture. So you want to look like the fellow right here with the green setup, right? You've got a nice straight back. It's a good setup. This slouch in this position, this can happen if your hamstrings are too tight. You know, so the hamstrings, again, they attach at the bum, they go past the knee. If they're too tight, they pull your pelvis backwards, and it makes it almost impossible to get into this nice position, okay? So you end up with that kind of flexion and that C curve in your back. If you're tight in your hip flexors, which is a different muscle that's in the front of the hip, you're gonna have the opposite of this. It's gonna end up curving the other way, which is also a lot of stress on your back when you're going to rotate and hit the ball. So if we're talking about just different things about when you're on the course. So if you're carrying your golf bag, and I know, you only see so many people carrying their golf bags, but it's great exercise if you can do it. So when you're carrying your bag, you want to make sure that it's at really only like a 20 to 25 degree angle. You know, I see a lot of people who have it kind of straight up and down. Oops, sorry. You know, straight up and down in this direction, where you really want it more or less pretty straight. And you want to use both straps. Even if you are going short distance, you want to take the time to put it on both shoulders so it can distribute the weight a little bit better. When you're putting your clubs in your bag, you want to take your the longer, heavier woods and put them closer to the body. So they should be in this compartment that's going to be nice and close to your body. The longer irons should go in the center of the bag, and your shorter clubs should be right in the front of it. And then everything else that you carry, your balls, your tees, your sunscreen, your snacks, whatever, should be distributed pretty evenly throughout the other compartments. And then sometimes people will ask if they're using a cart or a push or a pull cart, which way is better. So we talked about how that injury can happen from overuse and kind of that consistent one directional type of movement. So if you're always carrying, if you're pulling a cart behind you on one side all the time, that can be stressful for your shoulder and your back. So it's really better to push if you can. So like I said, I understand a lot of people use carts, but if you can do it, it's really it's a lot better for you, a lot more exercise to try to use the push cart. So this is when we're going to start getting into kind of the nitty gritty of what you can work on. And if we're going to go over some stuff, and then we'll look at some of the exercises I sent you. So stretching is really, really important for your golf game. So you want, what stretching does, it increases your circulation. It increases the release of endorphins, which are like your body's natural painkiller. And it increases the tissue length. So if you've got tight muscles and joints, stretching out is going to help that. The big thing for this is there are two different types of stretching. Most people don't really realize that. So there's dynamic stretching and static stretching. So when I ask people if they warm up before their game, a lot of people are doing static stretching, which, for example, if I'm going to stretch my neck, I'm tipping it to the side and I'm holding it for, 20 to 30 seconds, relaxing. I'm doing that 3 times. So if you've ever maybe had formal physical therapy for something, they maybe gave you static stretching to do. You actually want to keep that static stretching for after your round of golf or on the days you're not golfing. So what actually happens in studies of kind of muscle power is that when you do static stretching, that longer hold, you're stretching out the muscle, but you're temporarily making that muscle weaker. So if you are, this is kind of what we tell more high performance athletes, that before a game or before a round of golf, anything where you really want to perform your best, don't do static stretching, because that's going to, again, temporarily make that muscle weaker. So dynamic stretching is more of a quick stretch that you repeat. So you would do, 5 to 10 minutes worth of dynamic stretching before a round of golf. So if you have your handouts, you can kind of grab them and take a look, but these ones that are on the picture is what we're going to go over. So what I've done is I put in kind of the first column here, we've got our static stretches, okay? So this top one here is going to be the hamstring stretch. So everyone, if you can, I'll have you just try it for me. If you kind of sit, if you're somewhere that you can do this, if you sit your bum real close to the edge of the seat, okay? And then you're going to take whatever leg you're going to stretch first. You're going to put it straight out in front of you with the heel down on the ground, and then your knee has to stay really, really straight, kind of as straight as you can get your knee. Then you're gonna sit up really tall, kind of thinking of that ear and shoulder alignment, and you're gonna hinge forward from the hips. So your back should stay very straight. You shouldn't be slouching forward when you do it. When you do these stretches, you always wanna just go to the point of stretch, not pain, okay? So with that static stretch, you're going forward into that position, and then when you get to a good pull, you're gonna stay there for that 20 to 30 seconds. So if you look at the handout, you know, I wrote, you hold it for 30 seconds, you come back up, you can switch legs, do the other side for 30 seconds, do them each 2 times, you know, once or twice a day just to keep yourself limber is perfect. The second picture is just another way to stretch it. So if you are up and moving and you don't have the time to sit down for the stretch, you can just put your leg up on a bench or a chair or a stool, whatever you might have. Now, when we get to the last picture, if you look at the dynamic stretch handout, this is more of a repetitive movement. So when you do dynamic stretches, you should never be bouncing into the exercise. It's just that you're constantly moving. So you're walking in this position. You'd start with your arms kind of straight out in front of you, and you're just walking and kicking one leg out in front of you as far as you can. So it's just a gentle movement of the muscle to warm it up. You're not holding that end range stretch. So again, you would do, you know, 10 to 20 kicks alternating each leg, kind of walking around before you start your round. The second one at the bottom is going to be for that low back. So if you remember, one of the major factors for low back injuries on the golf course is low back inflexibility. So for this one, this first one would be your kind of that static stretching. You're laying on your back, knees are bent, feet are flat on the floor, and you're just rolling the legs over to one side. So your hips can come up, but your shoulders stay down. Again, you hold for that 30 seconds on one side, 30 seconds on the other. If you're seated or you're somewhere that you want to work on it seated, you can just put the hands across the chest and do that same rotation and hold it. But then the last one is that more dynamic one. If you can just take your golf club in front of you and just work side to side, right? So just, you know, 10 to 20 times on each side just to get that back nice and loosened up before you go. So now we're going to get into just some gentle stretches for at wrist. So trying to keep away that golfer's elbow. First is our static stretching. So you can do both directions of just kind of holding either way to get that either side of the forearm. Or the last one is that dynamic one when you take the golf club and kind of rotate the golf club side to side. And then the bottom one is for those pec muscles. So if you remember, I said that when we have that kind of chronic poor posture, we get really tight in our pec muscles, and then we continuously get weaker in our back muscles. So this picture here, you can do that static pec stretch either in a door frame like this girl is, and the arms you can see on the handout that I sent you, the girl has her arms kind of either at her side, up higher, down lower, wherever your shoulder feels best, it is fine to do. Just you want to feel that stretch right here in the chest, okay? And then dynamically on the course, you take your golf club and just kind of bring it up overhead, bring it back in front, bring it back overhead, bring it back in front, okay? So those are some really great stretches to get you nice and limber. Remember, before a round of golf, you're going to do the dynamic stretching, and then the static stuff can be on a day that you're, you know, either after a round or on a day you're not golfing. And then the strengthening stuff, we've gone over a couple of them. We talked about that stomach muscle, that transverse abdominis muscle. So the girl that's laying here in this first picture, she's, you know, we did it sitting up, but laying down is the easiest way to learn it. And again, that's on your strengthening handout. So if you're laying down, gravity will actually help engage the muscle a little bit. So it's the easiest position to learn it. So if you kind of lay down on your back like she is, and your hands just rest kind of right inside those little pointy, like bony parts of your pelvis, when you pull that belly button down towards your spine to engage that muscle, you should notice that your fingers kind of fall down. They don't pop up, they just fall, they come down towards the ground, and then you hold it. But again, you're not holding your breath when you do it. And you shouldn't have any movement in your pelvis or your back. It should just be that you have that engagement of the core, right? This is that glute tightening that we talked about. So kind of squeezing those glute muscles. Again, easiest to do it first laying down. And then if you really want to challenge yourself, you can practice just squeezing one side at a time. So a lot of people, they might be able to do that glute squeeze, but then if I ask them to just squeeze the left side, it's really hard for them to do. So you can practice kind of engaging the left and then the right. This one here at the bottom is going to get into those shoulder blade stabilizers to help the shoulder. So when this one you can do anywhere, when you're in the car, at a traffic light, anytime. So you're just going to take your shoulder blades and pull them together and down. Almost 9 times out of 10, when I tell people to pull their shoulders together, they pull them together and up. That's actually can contribute to some neck pain. So you want to make sure you're pulling them together and down. You also don't want to arch your low back when you do this. So if you pay attention to what your lower ribs are doing, they shouldn't kind of flare up when you do it. So it's just a gentle squeeze of the shoulder blades together and down. And then this very last one is a little bit of a complicated one. A lot of people, kind of depending on your flexibility and how well you're moving, it's sometimes hard for people to get on their bellies. So if you can get on your stomach, if you're in this type of position, you can put a couple pillows underneath your belly to kind of keep your back nice and flat. And then you're pulling that belly button up towards your spine again to engage your core. And then you're just doing opposite arm and leg lifts. So these can all be progressed or changed. These are very basic ways of doing it. When I put this together, I just wanted to pick out some of the biggest things. There's obviously, I give you a hamstring stretch and most people are tight in their hamstrings, but not everyone is. To know exactly whether you really truly need a hamstring stretch, you would have to be assessed individually, but most people need it and most people need these. Like I said, if some of these positions like laying on the belly are hard for you, there are other ways to do these exercises, but this is kind of the easiest, simplest way to do it. But again, sometimes back issues come from poor hip flexibility. So there's all sorts of different causes, but I picked kind of the most common causes to these things. So that is kind of the big things that I pulled out, and that is my presentation. My information is here if you want to jot down my email, if you have any questions for me. I'm going to leave that up for just a little bit longer. And then if you guys would like, I am willing to, I'm willing to answer questions. It is sometimes a little tricky to answer specific questions without having my hands on people to assess them directly, but I am going to stop sharing my screen and I am happy to answer any questions that anyone might have.
Okay, I'm a golfer, of course. My question is, for the first time last year, I'm having a problem with my bicep.
Yeah.
And I've never had that before.
So,
I even notice in the wintertime, if I shovel, there's something going on.
Yep, so your bicep, okay, there we go. So when I talked about that postural piece, the bicep tendon sits right here in the front of the shoulder. So when we have nice position and our shoulder is in that alignment, if you could imagine the bicep tendon kind of runs between two bones. So it sits in between these two bones. It's got plenty of room. When we slouch forward, that space gets smaller and then the bicep tendon gets impinged and it can get swollen. So when you're rounded forward in golfing, that can give you that bicep tendonitis. When you're then engaging the biceps, when you're shoveling, that can do it even more. So a lot of times that bicep thing, that can be helped by that stretch for the front of the chest in the doorway and then those shoulder blade squeezes. Again, not all the time, but that's kind of the basic way you would start trying to address those.
Okay, thank you.
Yeah, you're welcome. Anyone else have any questions? Hi, just talk, you can talk.
Do you do golf assessments? I mean, are actually swinging and, conditioning, like a golf conditioning type of program?
I do. Yep, I have an assessment that I do. There's an institute of golf throughout the country that kind of set up a PT standard of how they would look at your swing, look at your rotation. So I do those. It is something that's not covered by insurance because most insurances don't care about your golf.
Right.
Right. So if you came in and said you were having trouble shoveling, insurance would pay for that. But if you're coming in saying, I'm having problems golfing, they don't pay for that. But yes, I do that. So if you would like to, you can certainly email me and we can chat about it. What I do is I come to people's houses too. So I try to, my clinic is mobile. So I travel to people.
Oh, I see. So
yeah.
you don't have a facility where you work.
I do not. This lovely facility behind me is a filter.
Oh, okay. Okay.
I'm actually in my living room, so it's just a filter.
Okay. Good.
Yeah, like I said, this talk is a very kind of general overview that most people will benefit from the stuff. But sometimes if you want to get into the nitty gritty, you need the more specific assessment done. But I do those.
Okay.
Anyone else? I'm happy to answer any other questions. All right, so like I said, if if you look at your the handouts, and if something just doesn't make sense or the way I worded it doesn't quite make sense, my phone number's on there, my email's on there. Feel free to reach out to me, and I'm happy to kind of talk you through it.
Okay, one more question.
Oh, yeah, sure.
Do you suggest, like you're at the course, do you suggest, just 2 or 3 things that you should do before you hit a golf ball?
Well, so like I say, the best thing to do is to spend 5 to 10 minutes before your round of golf doing some of that stretching, kind of hitting all parts of the body. So if you take that sheet of dynamic stretches and just do those beforehand, then you should just be able to then go play your round of golf.
I see.
There's something you have to do in between each one. You just want to make sure you're warmed up good before.
Okay. This was great. Thank you.
Well, thank you for coming. Thank you to everyone for coming. I appreciate it. And thank you for hosting me.
I'm not a golfer, but I do have lower back trouble, so this should be very helpful.
Okay,
Thank
good.
you.
Yeah. So do those transverse abdominis muscles. They're super important. All right. Well, thank you so much, everyone, for coming. I appreciate everyone's time. And
All right.
I look forward to hearing
Thank you, everyone.
questions. Thank you.